Well, 101. In today's live broadcast, we're going to be talking about a very, very serious medical emergency. Okay, so if you are having any of these symptoms that I'm going to be mentioning, please seek a medical help because it can be fatal. Okay, so this is a very, very serious medical situation. So in today's video, we're going to be in today's live broadcast, we're going to be talking about thyroid storm. Okay, we're going to be talking about thyroid storm. Thyroid storm is a rare but life-threatening medical emergency. Okay, caused by an extreme sudden surge of thyroid hormone in the body. It is a severe complication of untreated or poorly controlled hyperthyroidism, most commonly from grave disease. Okay, the most common cause of thyroid of hyperthyroidism is grave disease, and the most common cause of thyroid storm is hyperthyroidism. So it's interwoven. So what causes thyroid storm? Thyroid storm usually happens when someone always has hyperthyroidism and a major stress trigger it. So it can be triggered by a major stress. Okay, so what are the common trigger of thyroid storm? Remember what we said, that thyroid storm is a rare but life-threatening medical emergency caused by an extreme sudden surge of thyroid hormone in the body. I will say that it is a severe complication of untreated or poorly controlled hyperthyroidism, most commonly from grave disease. It causes the body metabolism to become dangerously overactive. It is a medical emergency. Don't play with it. So, what triggered thyroid storm? I will say that thyroid storm usually happens when someone already has hyperthyroidism and a major stress trigger it. So what are the triggers? The common trigger will be one, untreated or poorly controlled hyperthyroidism. Okay? Infection like pneumonia or urinary tract infection can also trigger thyroid storm. Surgery, especially thyroid surgery, can also trigger thyroid storm. Do not forget that thyroid storm is a medical emergency. It can be fatal. Severe stress or trauma can also trigger thyroid storm. Please do not forget to subscribe and like. Do not forget to subscribe to this channel. Heart attack. Heart attack is a common trigger of thyroid storm. Stopping your thyroid medication suddenly can also trigger thyroid storm. Childbirth can also trigger thyroid storm. Iodine overload, contains dry or certain medication, can also trigger thyroid storm. Please do not forget that a thyroid storm is a medical emergency. Okay, thyroid storm is a rare but it's a life-threatening medical emergency caused by an extreme sudden surge of thyroid hormone in the body. It is a medical emergency, and it is a severe complication of untreated or poorly controlled hyperthyroidism, most commonly from grave disease. It causes the body metabolism to become dangerously overactive. So, what are the symptoms of thyroid storm? This condition progresses quickly and can be fatal without medical care. And I repeat again, this condition progresses quickly and can be fatal without emergency care. Thyroid storm is a medical emergency. So if you are having any of these symptoms that I'm going to be mentioning, please seek medical help immediately, because this is a medical emergency and it can be fatal. If you are having a very high fever, often above 103 Fahrenheit or 39.5 degrees centigrade, seek medical help. Okay, you have a severe rapid heart rate, tachycardia. Severe rapid heart rate, this is also known as tachycardia. It might be a symptom of thyroid storm. Please seek medical help immediately. Do not forget to subscribe to this channel. Do not forget to subscribe, okay? So irregular heartbeat can also be a symptom of thyroid storm. High blood pressure early, low blood pressure late can also be a symptom of thyroid storm. Okay? Agitation, confusion, delirium, these are early signs of thyroid storm. Vomiting and diarrhea is also one of the symptoms of thyroid storm. Severe sweating. If you are sweating profusely, it might be a symptom of thyroid storm. And do not forget that thyroid storm is a medical emergency. Or you have shaking, your body shaking, tremors, it might be a symptom of thyroid storm. Shortness of breath can also be a symptom of thyroid storm. Possible coma, C-O-M-A, coma, possible coma is also a common symptom of thyroid storm. This is a medical emergency. Call 911 immediately if suspected. How can thyroid storm be prevented? How can we prevent thyroid storm? Prevention focuses on proper management of hyperthyroidism. Treat hyperthyroidism early. Prevention is better than cure. That's why we always emphasize that you go for your medical check-up as scheduled. Go for your routine checkup, because prevention is better than cure. So treat hyperthyroidism early. Work with a doctor to control thyroid level using anti-thyroid medication like metamelazone or PTU. We are not prescribing medication here, nor does this constitute medical diagnosis. We're only creating a healthcare awareness, okay? Radioactive iodine therapy can also be used by physician. Surgery if needed. How can thyroid storm be prevented? Okay, I will say that work with a doctor to control your thyroid level using anti-thyroid medication like metamelazone or PTU. Radioactive iodine therapy. Surgery if needed. Never stop thyroid medication suddenly. This will trigger thyroid storm. Never stop taking your thyroid medication suddenly, because this will trigger thyroid storm. Stopping medication abruptly is a major risk factor for thyroid storm. Do not forget, thyroid storm can be fatal. It is a medical emergency. Okay? Treat infection quickly. get prompt treatment for fever, pneumonia, urinary tract infection, or other infections. Treat infection quickly because this can trigger thyroid. Okay, inform doctor before surgery. If you have hyperthyroidism, make sure you make your medical provider know before surgery because ensure it is well controlled before any procedures. All these are measures that thyroid storm can be prevented. Okay, regular thyroid monitoring, very essential. Routine blood tests test you for your TSH, T3, T4 to help prevent complications. So, who is at risk for thyroid storm? Who is at risk for thyroid storm? I would say that people with untreated hyperthyroidism, they are at risk for thyroid storm. Those with grave disease, they are also at risk for thyroid storm. Pregnant women with uncontrolled thyroid disease, they are also at risk for thyroid storm. Elderly patients, they are also at risk for thyroid storm. The bottom line is thyroid storm is really but extremely dangerous. It almost always occurs in someone with unknown or undiagnosed hyperthyroidism who experience a major trigger. Early treatment of thyroid storm is a strong prevention. Do not forget, prevention is what is better than cure. So we're going to take this again. Take this one more time. Okay, we're talking about thyroid storm. I will say that thyroid storm is, for the sake of those who are joining us, we'll run through this again. Okay, we'll recap. We're saying that a thyroid storm is a rare but life-threatening medical emergency caused by an extreme sudden surge of thyroid hormone in the body. It is a severe complication of untreated or poorly controlled hyperthyroidism, most commonly from grave disease. So if you have grave disease and it is poorly controlled or poorly treated, this can trigger the thyroid storm. Okay, it is a severe complication of untreated or poorly controlled hyperthyroidism, mostly common from grave disease. So it causes the body metabolism to become dangerously overactive. So what causes thyroid storm? I would say that thyroid storm usually happens when someone always has hyperthyroidism and a major stress triggered it. We also say that common trigger is untreated or poorly controlled hyperthyroidism. Infection can also trigger thyroid storm, infection like pneumonia or urinary tract infection, fever, high fever. Untreated infection can trigger thyroid storm. Surgery can also trigger thyroid storm, especially thyroid surgery can trigger thyroid storm. Severe stress or trauma can also trigger the thyroid storm. Heart attack can trigger thyroid storm. Stopping thyroid medication suddenly can also trigger thyroid storm. Okay, so and we also say that childbirth can also trigger the process of childbirth can also trigger thyroid storm. I would say that iodine overload, contrast dry or setting medication can also trigger the thyroid storm. And I would say that some of the symptoms of thyroid storm symptom of thyroid storm. We say that this condition progresses quickly and can be fatal without emergency care. So the symptom of thyroid storm progresses quickly and can be fatal without emergency care. So very high fever, often above 103 degrees Fahrenheit or 39.5 degrees centigrade. These are some of the symptoms of thyroid storm. If they are not quickly treated, it can be fatal. Severe rapid heart rate. Severe rapid heart rate. This is tachycardia. It is a medical emergency. These are common symptoms of thyroid storm. These symptoms are telling you that this condition progresses quickly and can be fatal without emergency care. So if you're having a severe rapid heart rate, seek medical care. Irregular heartbeat is also a symptom of thyroid storm. High blood pressure in the early stage, then low blood pressure in the late stage of thyroid storm. Those are common symptoms of thyroid storm. So if you're having high pressure at one time, they suddenly go all the way low, rapidly progresses to low blood pressure. These are symptoms of thyroid storm. This condition progresses quickly and can be fatal without emergency care. Agitation, you become agitated, and also you are confused. You become confused, delirium. Okay, these are conditions that progresses quickly and can be fatal. So seek medical help. You're having vomiting, nausea, vomiting, and diarrhea. These are symptoms of thyroid storm that progresses quickly. So you need emergency care, or it can be fatal. Your severe sweating is also a symptom of thyroid storm. Shaking, tremors are also symptoms of thyroid storm. Do not forget that this condition progresses quickly, okay, and can be fatal without emergency care. So if noticing any of these symptoms, do not hesitate to go to the nearest urgent care in this hospital, okay, because this is a medical emergency and it can be fatal, okay. Shortness of breath, seek medical help. Possible coma, also seek medical help. This is a medical emergency. Call 911 immediately if suspected. So if you're having all these symptoms, while this does not constitute diagnosis or treatment, but if you're experiencing any of these symptoms, we encourage you to call 911 immediately if suspected. Okay, so how can thyroid storm be prevented? How can we prevent thyroid storm? I would say that prevention focuses on proper management of hyperthyroidism. Hyperthyroidism. So prevention focuses on proper treatment of hyperthyroidism. Okay, so treat hyperthyroidism early. Work with doctor to control thyroid level using anti-thyroid medication. Radioactive iodine therapy can also be used. Surgery can also be done if needed. Okay, so never stop thyroid medication suddenly because this will trigger thyroid storm. Stopping medications abruptly is a major risk factor. It triggered thyroid storm. If you're on thyroid medication, never stop it suddenly. You talk to a medical doctor. If you want to take you off of it, it's going to be a gradual process to titrate and weigh you off of it. Treat medication quickly. Treat infection quickly. Get prompt treatment for fever, pneumonia, urinary tract infection, or other infection. So treat infection quickly. and also inform doctor before surgery. So if you have a hyperthyroidism and you're about to have a surgeon, make sure you talk to your provider. Let the surgeon know that you have this condition. So ensure it is well controlled before the procedure. Okay? Regular thyroid monitoring. We always emphasize on prevention in this platform because we strongly believe that prevention is better than cure. That's why we encourage you to go for your routine medical checkup. And we are saying that monitoring your thyroid regularly, routine blood tests like your TSH, T3, T4 levels should be checked if you have a problem with thyroid, because it helps prevent complication. Okay. So, who is at risk for thyroid storm? Who is at risk? I would say that people who are at risk will be people with untreated hyperthyroidism. They are the one at risk. People with grave disease, they are at risk for thyroid storm. Pregnant women with uncontrolled thyroid disease, they are also at risk for thyroid disease or thyroid storm. Elderly patients, they are also at risk. Bottom line is, thyroid storm is a rare but extreme dangerous. Okay, it is almost always occur in someone with known or unknown hyperthyroidism who experience a major trigger. Okay, early treatment of thyroidism is a very strong prevention of thyroid storm. Okay, so let's look at how is thyroid storm treated at the hospital. Well, remember, I will say that it is a medical emergency, and you got to go to the ER immediately if you're experiencing the symptoms that I have just mentioned. Okay, like we said, that the thyroid storm is a life-threatening medical emergency caused by extreme high thyroid hormone activity. It usually happens in people with untreated or poorly controlled hyperthyroidism, often due to grave disease. Treatment in the hospital is aggressive and done in the ICU. I told you it is a medical emergency. The treatment of thyroid storm is done in the ICU, and treatment in the hospital is and also very, very aggressive because it can be fatal. Okay, it is done in the ICU. So how thyroid storm is treated at the hospital? Treatment focusing in 5 main goals. 1, block the effect of thyroid hormone, beta blocker. Doctor give IV beta blocker usually, proprapanol. Okay, sometimes esmolol, especially if heart rate is very high. So give IV of beta blocker to stop rapid heart rate if the heart rate is extremely high. Because this helps slow heart rate and reduce blood pressure, decreases tremor, reduces high risk of heart failure. So you will be put on a beta blocker IV. Okay, they can also stop new thyroid hormone production. So they do anti-thyroid medication is given, PTU. Okay, it can also be given, often preferred initially. Okay, so they try to stop new thyroid hormone production when you're in the urgent care or the ICU. Is all treated very, very aggressively. So this drug stops the thyroid from making more hormones. PTU also reduces conversion of T3, T4, T3, this more active form. Okay, so block release of stored thyroid hormone, iodine. Okay, after anti-thyroid medication is given, doctor will administer logo iodine or potassium iodine. The important Importantly, the important is this: iodine is given after PTU, metamazone, to prevent worsening hormone release. Okay, steroid can also be used at the hospital to protect organ and reduce hormone conversion. Doctor give IV corticosteroid like hydrocortisone. This help reduce T4 T3 conversion, protect against adrenal insufficiency, reduces inflammation. Okay, supportive intensive care, because thyroid storm affect the whole body. Supportive treatment is critical. Okay, oxygen, IV fluid, cold blanket for high fever, acetaminophen, not aspirin, treatment of infection if present. Okay, heart rhythm monitoring, sometimes ventilator support. Like I said, it is a medical emergency and it can be fatal. So they put you on ventilator sometime. If heart complication occur, if severe heart failure or dangerous rhythm happen, ICU cardiac management will put it diuretic will be used, advanced life support if needed. Rare or severe cases, if medication does not work, plasmapheresis remove thyroid hormone from blood. Okay, emergency thyroidostomy, which is also rare, can also be done. Why it is dangerous? Thyroidostom can cause heart failure, stroke, severe dehydration, multiple organ failure, death if untreated. Mortality can be 10 to 30% even with treatment, which is why rapid ICU care is critical. Okay, so for the sake of you who are just joining us, we're going to do what? We're going to rush through this again. Okay, we'll rush through how is thyroid treated at the hospital. We'll rush through it again, okay, for the sake of those who are just joining us. We said that thyroid is a life-threatening medical emergency caused by extreme high thyroid hormone activity. It usually happens in people with untreated or poorly controlled hyperthyroidism, often due to grave disease. I would say that treatment in the hospital is aggressive and done in the ICU. We also said that thyroid storm is treated in the hospital. Treatments focusing in 5 main goals. 1, block the effect of thyroid hormone, beta blocker. So doctor will recommend IV beta blocker, usually propranolol, and sometimes exmolol, especially if the heart rate is very, very high. Okay, this happens. This helps slow heart rate, reduce blood pressure, and decrease tremors, reducing risk of heart failure. Okay, so if you're joining us for the first time, please kindly subscribe. Okay, subscribe. Okay, we also said that doctor have to stop new thyroid hormone production because anti-thyroid medication are given. Okay, PTU often preferred initially, or metamazone can also be given to help prevent hormone production. Okay, this drug stop thyroid from making more hormones. It also PTU also reduces conversion of T4 to T3, 2,4 T3, the most active form. Okay, block release of stored thyroid hormone, iodine. Okay, so after anti-thyroid medication is given, doctor administer glucose iodine or potassium iodine. Important, iodine is given after PTU, metamazole, to prevent worsening hormone release. Also, steroid protect organ and reduce hormone conversion. So doctor give IV corticosteroid like hydrocortisone, because this help reduces 4 to 6% conversion. It also protect against adrenal insufficiency. Okay, it also reduces inflammation. So supportive intensive care, because thyroid storm affect the whole body. Supportive treatment is critical. So oxygen, IV. So supportive intensive care is put in place. Okay, because we know that this supportive is critical because thyroid storm affect the whole body. So supportive treatment will be like oxygen, IV fluid, cooling blanket for high fever, acetaminophen, not aspirin. Treatment of infection if present, heart rhythm, monitoring, and sometimes ventilator support. So if your heart complication occur, if severe heart failure or dangerous rhythm happen, ICU cardiac management will put in place. Diuretic also put in place, and advanced life support if needed. Rare or severe cases, if medication do not work, plasmapheresis remove the thyroid hormone from the blood. Emergency thyroidectomy, which is rare, is also done to put it under control. Why it is dangerous, that thyroid storm can cause heart failure, can also cause stroke, can also cause severe hypertension, multi-organ disease, and death if untreated. Okay, mortality can be 10 to 30% even with treatment, which is why rapid ICU care is critical. Okay, so like I said, if you have the symptoms that I have mentioned, please seek medical help because it is a medical emergency. Okay, this is Gateway 101. Thank you for watching. Until I come your way again, this is Gateway 101. Thank you for watching and God bless. Bye for now.